Zara Poonawala is a licensed mental health professional from University of Denver, Colorado. She has been working with families and children with mental health concerns over the last 10 years. She's so young, and yet there is such a vast experience there. And she is one of the few certified equine assisted mental health practitioners and animal assisted therapist AAT in UAE and in India. And she has done this equine therapy and also animal assisted therapy courses, intensive courses. I think the equine therapy course is like 568 hours or something from Denver, Colorado. So it's really rare that you find. I mean, I really appreciate it because my son here goes to to one of these equine therapy centers, and I've seen how things happen there. I mean, it is in spite of not having people with clinical psychology background, it works really well. So I can imagine how it. I mean, fortunate people are those who are going to Zara actually for therapy sessions. So she has been actively involved in creating one of the first equine assisted support groups for parents of children with special needs in Dubai. So it's like not just for the children themselves or peers who have any challenges, but also along with that, she's also taking care of the family members and the other caregivers, which is very much in line with what Margika does. So once again, thanks so much. And let us start with our discussion.
Sorry, thank you so much. So basically, equine-assisted therapy is very, very similar to animal-assisted therapy. And I believe you spoke to my colleague, Meenal, from Animal Angels a couple of weeks ago. So it's pretty much the same philosophy where a mental health professional will then add an equine or a horse to a therapy setting to basically help a client achieve whatever therapeutic goals that the client possibly might have. And basically the field of equine assisted therapy is really, really vast. And in order for us to sort of understand this a little bit better, I actually have a little presentation, or actually just a slide to sort of explain better. Just because this field is so new, there's a lot of misinformation out there. So I just wanted everyone to have a better understanding of what the field actually sort of looks like. So basically what EAT stands for is Equine Assisted Activities and Therapies. So this is basically an umbrella term that is sort of used to describe all activities that fall under equine assisted work or interventions. When I say equine assisted interventions, like I said, this is an umbrella term, and all it means is simply means is incorporating a horse in different settings to sort of benefit the population or the clientele that you're working with. Under equine assisted activities and therapies, there is something called equine assisted activity and equine assisted therapy. Now, what is the difference between an equine assisted activity and what is the difference between to that of equine assisted therapy? Equine assisted activity is simply when you sort of incorporate the horse to help improve the quality of life of whatever population or clientele you are sort of working with. Just on a side note, I want you to understand, I'm using the word incorporate the horse and not working or not using the horse because in equine assisted therapy, our horse is sort of my partner or my co-therapist, or the herd of horses is my partner, are different partners or co-therapists. So in any kind of activities, when you involve animal, it's really important to sort of maintain welfare for the horses. So just having said that, equine assisted activities has two subdivisions where you have therapeutic riding and you have equine assisted learning. So therapeutic riding sort of sounds like what Dr. Nina was talking about with her son going to a facility and sort of learning riding. So this program is basically focused on building riding skills for someone with special needs. And by default, they would have all the benefits of just interacting with the horses, which is something we will get to in some time. When we talk about equine assisted learning, equine assisted learning is, again, we are developing life skills. So it's more like professionals like life coaches or leadership programs incorporating horses and things like that. So you would then an equine assisted learning program would basically focus on leadership. So it would be catered to like uh, corporates and things like that who are trying to build skill sets for their managers or for their leaders or the CEOs through incorporating horses within the training and sort of observing their communication and their body language and their behavior, and then making comments and practicing new skills. And then post which we'd kind of look at equine assisted therapy. So equine assisted therapy, again, is different from equine assisted activity because you have a health professional. So it could be a mental health professional, it could be a physical health professional like a physiotherapist, a physical therapist, an occupational therapist, a speech therapist, or any sort of counselor or mental health professional. And equine assisted therapy has two subcategories, which is called the hippotherapy and equine assisted mental health. Now, hippotherapy is more focused for our physical health. So, again, these would be sessions with where you would have a physical or a physiotherapist putting a client on a horse and doing some riding. Just as we are aware now that when we sit on a horse and we ride a horse, that sort of mimics the movement of walking. So if you put someone with any sort of disability where they're not able to move, we're actually sort of creating a sensation of what it feels like to walk, because the horse rhythm or movement mimics humans walking as well. So again, hippotherapy has all the physical health professionals. And then equine assisted mental health basically focuses on mental health issues. So we would then work on anything to do with helping with anxiety, building social skills, improving family dynamics, and dealing with trauma and things like that. How equine assisted activities are different from equine assisted therapy. One is there's a certified mental health professional of some sort of involved. The second thing I would like to say that this is goal driven. So the goals are sort of documented and monitored throughout the sessions, following sessions, versus it being more a visitation thing. There could be plans, but this is more therapeutic in that sense. So yeah, this is basically what equine assisted activities and therapies sort of consists
how
of.
it happens in real life also with if you can, since our focus is on special needs children, if the example can be from like say autism or any specific such challenge
Okay.
with that, if you could
Sure. So I'm going to give you two examples. One is going to be an example of a child on the autism spectrum that I've been working with or was working with. And it's not a super detailed or prolonged therapy session. So that's going to be one. And the other, I'm going to give you an example because, like you mentioned, there's a lot of parents out here. And I feel like caretakers or caregivers of kids or children with special needs sort of often forget to take care of themselves. And I want to sort of also give you an example of how the support group that I run sort of helps families at large. So coming to the child on the autism spectrum. So this was a very young boy. He was possibly 6 years old. And we had organized a summer camp for children with special needs. And I just he was extremely emotionally dysregulated. So he was sort of all over the place, running around, was finding it difficult to be present and be focused on certain activities that were planned for him. that day we sort of took him and we had our session with the horses, and it was just a meet and greet where the children simply had the opportunity to sit down and sort of groom the horses. And as he was sort of doing that, we realized that he was really enjoying all the sensory input that he was receiving from working on the surface of this horse. So we decided to put him bareback on the horse and just sort of really massage the horse and gently stroke it and feel the mane of the horse and the tail, and just explore the whole surface and the different muscle groups and things like that. And this very tiny, it wouldn't even be a therapy session, but this very tiny animal assisted activity, equine assisted activity, which probably lasted 10 or 15 minutes, had a very profound effect on this child, because the next evening, his mom comes to me and she literally is telling me that, what have you done to my child? And first, initially, we were scared because we thought something happened. And then she's like, no, I have never seen him be this calm and relaxed. And, post coming to these sessions with you, specifically on that day, he sort of was not only calm that whole evening, but then was calm all of the next day. So it just really sort of helped emotionally regulate this little boy. Yeah. And the reason why I'm saying this, and it's really important to understand that equine assisted therapy, or even just animal assisted therapy in general, is not just simply playing with animals. There's actually very in-depth science involved behind it. So if you look at research studies, what research studies are now telling us is that when you actually stroke an animal, and even if that is just for 10 minutes or 5 minutes, there's neurochemical changes sort of going on within our cells and our system. And what that means is basically there is a drop in cortisol levels, and cortisol is nothing but your stress hormone. And there is an increase in oxytocin, serotonin, dopamine, which is very simply put our cuddle hormone. So what's happening is you're reducing the level of stress and you're increasing the levels that sort of leave us feeling happy. And again, as we know that when we're happy, we're able to absorb and learn and regulate our emotions a lot better versus when we're sort of feeling really, really stressed. So this is one example. And as I'm talking about this, I'm also like thinking about this other little girl, again, on the autism spectrum. She was possibly 7 or 8 years old, had moderate to severe autism. She is cognitively high functioning, but was really struggling. I wouldn't say high function, but her cognitions were sort of in place, and she could sort of follow instructions and things like that, but was nonverbal. And whenever we went to the barn to sort of do the stables to do different chores like feeding the horse and mucking the stalls and grooming the horses, she would have to then listen to instructions that we were sort of asking her to follow and then implement those. And as she sort of went through a couple of sessions, here is like a very inattentive child who, if we took our eyes off of her for even a few seconds, we would see her sprinting across the stables, was then able to sort of, gather herself and be regulated and actually follow through whatever instructions we've been sort of asking her to do. So again, that's one of the ways that it sort of helps with social skills. So yeah, I'm not sure if these examples are enough. And just coming to the examples of the support group and the parents. So usually what happens is parents as caretakers spend a lot of time and energy and resources looking after their little ones with special needs. And it is one of the most hardest and most challenging things a human being can endure and go through, like parenting and just being a new mom. I've realized and appreciate how difficult it is. And then just adding that with layers of special needs sort of really is extremely stressful. And this is not just me saying it. This is, again, research saying that kids who have emotional and behavioral issues, their parents sort of have the highest levels of stress versus having a child who's actually physically ill. So just to sort of really provide emotional support and self-care for these parents, it's been helpful to sort of have the support group, because for the first time parents can actually stop thinking about their children and think about themselves for a while. In a place like Dubai, where the resources are sort of limited, parents sort of are coming together and actually sharing their own personal experiences and expertise and things that have helped them with each other. So that it creates that space of not being lonely. And then just looking at one specific story or narrative from this mom who sort of came in. So she basically was there because her nanny forced her to come to the support group. And as she was there, this was the first time that she was interacting with a horse. She's actually a doctor by profession, and so she's very, very busy and has a really busy career. Uh, Again, spending 10 minutes just focusing on the sensory experience and interaction with the horse uh, sort of got her to become still and calm in her mind. And she was left with this really beautiful insight that she needs to be like the horse, because the horse was nurturing and taking care of her so much, even though they were sort of strangers to each other. And she needs to sort of then extend that sense of nurture and love and time for her children as well. And then, like, that sort of helped her go back and improve and really think about her relationship with her kids.